Good morning, everybody. Thank you for inviting me to take part in this contribution. I'd like to represent the initiatives which were started by the Ministry of Health in e-health in these last 3 years. The importance of e-health and its impact on health and society are well known at national and international level. Here we refer to the Prague Declaration on which covers e-health that must be aimed at improving quality and efficiency of healthcare services with the benefits at the level of the system as a whole, at the level of the citizen, at the level of society and the economic level, with a potential saving of the healthcare costs. More recently, within the strategic plan Europe 2020, there should be a European agenda for the providing white space for e-health with key actions that can favor the development and dissemination at the European level, in particular to guarantee safe access online to the data of European citizens, to disseminate telemedicine, e-medicine. And so in this context, for interest of e-health, in 2008, the Ministry of Health organized a working group aimed at developing initiatives of networked healthcare along some important lines. The COOP, the booking center, FSE, e-medicine, e-prescription, and e-certificates, with a reduction in the number of documents and better harmonization of solutions. In all these sectors, we used a methodology common work divided it into phases, starting from an assessment of as is, on the state of the art, through recognitions, technical in-depth examination, and possible actions to be with guidelines, standards and provisions to reach an implementation through the application of these guidelines and regional action plans. And this slide indicates the work in progress in the different sectors. And I will not go into details of the different sectors, but this is just to show that starting from 2008, that is the as-is phase, up to the implementation in most of these situations. As for the booking center, in order to have an overall view of the state of the art of these booking system at national level, the first initiative was to develop a recognition that is an as-is, and all the regions and provinces cooperated, and we had an overall view that highlighted remarkable proliferation of booking system at national level, but also a rather heterogeneous situation for the availability, the coverage, and also the characteristic features of the implemented system. So the next phase was that of pre-setting national guidelines for this booking system that touched upon different aspects, that is organization and management, semantic aspect, functional aspects, performance aspect, and infrastructural aspects. The guidelines at the State Region Conference were then presented, and so they are now implemented. And in particular, the enforcement of these guidelines will be further discussed, and a reference is made in these guidelines to the national plan of waiting lists approved last year at this region state conference. That reference is made to these guidelines for the automated function of the prescriptions, development, and reporting of results. Now, for the FSE system, we wanted to have an overall picture of the state-of-the-art at national level. In this case, too, recognition highlighted a dynamic situation, and all provinces and regions have prototypes of initiatives in the e-health. But this is rather fragmented and heterogeneous for the maturity of the projects and for their application and architecture with regard to the adopted solutions. So the ministry organized an interinstitutional table for the FSE, that is for the health report, personal health report, and in particular in Tuscany and in the Emilia region. We have identified the digitalization and technological innovation department, and in the DGTPA, which is for the computerization of public administration, which also includes a guarantor for personal data. The table set itself some aims, and in particular the reorganization of common unitary standards, also for the personal report and for an implementation system. So we started from a standard that was introduced in a bill submitted by the Ministry of Health, and that was approved by the Council of Ministers last March, and is now following its parliamentary course. So this means all digital data for the social health of events of every patient, which is continuously updated by all the different operators of the National Health Service. This is organized at the level of the regions, and the aim is to foster care, prevention, and rehabilitation. But its aim is also to study and investigate into the medical, biomedical, epidemiological field, and also to control the National Health Service. Access to this report must be authorized by the stakeholders, and this will all be controlled by regulations. As for the guidelines, these touch upon different aspects that are listed in this slide, and in particular for the protection of personal data, they refer to the guidelines
elettronico e dossier sanitario che sono state pubblicati.
And all these have been published by the guarantor on the processing of personal data. And for the infrastructure, there is an agreement with an infrastructure project that will be implemented by a collaboration between the Department of Technological Innovation and the ICT Department for the National Research Center. The guidelines have been approved by this conference last February. At this table, they're now discussing the draft regulations, and this includes also the Veneto region and is focusing in particular on aspects related to the patient's record. We have e-health or telemedicine, which focuses on innovative technology in a situation where the health operators of the patient are not in the same place, in the same location, but we must focus on the doctor-patient relationship, which must always be considered and must be valorized to improve the quality and the efficiency of these services. The ministry has always paid great attention for telemedicine and for e-medicine, and is taking part in many projects, such as the network of rare types of cancer to share data, documents, and clinical protocols. So also the telemedicine of small organization in Lombardy, and the connection in telemedicine of the earlier archipelago, and the broadband system for all scientific institutions at national level. Another initiative concerns the participation in the e-care project with the e-care observatory. This is a national level monitoring telemedicine, and the ministry is taking part also as part of a special convention. The aim of this observatory is to identify best practices in e-medicine at national level, and in this sense, they must also define performance indicators. This observatory focused its activities on home care, but is also gradually extending its field of interest. More recently, there is a table for e-medicine within the Higher Ministry of Health, therefore representative from the ministry, from the council, and the experts. This discussion table, which had its first meetings last February, intends to intervene and set up some guidelines touching upon several aspects of telemedicine, from definition, classification, organization, priorities, infrastructures, economical analysis, standards, and identification of best practices. So the final scope is of providing guidelines that can ensure a consistent development and dissemination of telemedicine at national level. As for the e-prescription, according to a decree of last March, controls or governs this research by national health doctors, and the Ministry of Health has taken part in defining the implementation plans at regional level, and the decree law turned into law 122 describes that paper prescription has to be replaced by e-prescription, and wants the use of the same platform by all doctors for e-transfer. And as for e-prescriptions and certificates, the ministry, as in agreement with the Ministry of Economics and Business, has issued a ministerial decree controlling the transfer of prescriptions from doctors to IMSS and to the workers both in the private and public sector. This is still in progress, and at the ministry they have activated a group to monitor the process and identify criticalities and suggest possible solutions in this system. As for the dematerialization, the ministry set national guidelines for the dematerialization, which has to be turned into imaging diagnostics in agreement with the different regions, and this will have to be approved by the special conference, and it's a first step forward that will be followed by others aimed at the dematerialization of other documents and data for the different disciplines. In conclusion, I would say that the initiatives undertaken by the Ministry of Health are aimed at pre-setting a unitary framework of reference and in the different sectors of e-health, and this is the path that we want to pursue for the actual networking of e-health for correct development and use of solutions. We need to rationalize the funding at all institutional levels, but we also need a systematic implementation and a cooperation and synergy of all actors involved. And I believe that cooperation between the different parties is fundamental to reach the objectives and the implementation of e-health at national level. And thank you very much for your kind attention.
Ringraziando la dottoressa, alla quale non porgo una domanda come quella a Martin.
Now, question, a proposal rather from Aiop Giovani. Can we take part in one of your tables or discussions, trying to bring the experience of the private sector, the certified one, which is both active and passive agent of the change? We would very much like to be there with you. First of all, thank you very much for the availability. I will certainly refer this to the Minister. Clearly, in this first phase, as you saw, we had discussions among institutions, but we have come to the point